It's webinar 69 on total transformation secrets, and today's topic is liquid intelligence. Oh my goodness. I have to be honest, ChatGPT came up with this title, but I it I was like, I have to change everything to talk about liquid intelligence, your body's dashboard for hydration, flow, and kidney wellness. Your kidneys do so much. They tell you about your uh or they control. In fact, one of my nicknames for the kidneys is the adjustment bureau because they adjust your hydration, they adjust your electrolytes and your pH balance and so much more. And I just, like I said, I had to even change my whole uh this is now going to be a mini series on all the things that the kidney does. So without understanding, what we have in our urine, how special it is, it's not just waste, but your toilet, I love this, may be the cheapest lab test in your house. And without understanding what you see in the toilet, you could be driving blind. So we want to shed all the light on the information that your kidneys and your urine tell us. So it's like having a report, a diagnostic report. And it's one of I call it the Goldilocks zone, is one of those measurements. You don't want it to be too low because that means there's a problem. You've over diluted. And now you're going to be losing electrolytes and other things. You don't want to be too high because then you're dehydrated, which narrows your blood vessels. So that puts at risk the capillaries. And you don't want to have too much sugar. You don't want to have too much, you don't want to have any protein or red blood cells in your urine. So we want our urine just right. And this was from the last webinar, and I love this diagram. So this is the start of the production of urine. So we've got our kidney over here, and remember the cortex of the kidney was the outer edge of the kidney, which is where all of these tubules are. And the round parts, the balls, I call them, the balls are the glomeruli. And in the balls, blood goes in, it's under pressure. And so because of the pressure, it pushes plasma or fluid, we call it filtrate, out of the blood, out of the capillary, and into this capsule. And this capsule, this filtrate, is the beginning of urine. But before it's called urine, it goes through all of these tubules. The proximal convoluted tubule goes down into ah, I didn't mean to do that. Descending loop. I don't know if I can get back. Yeah, the descending loop, then up the ascending loop, then another convoluted tubule, and then just so many things are happening in these tubules, and we're going to talk about it in the future. But the final um, exit is down to the bladder where it produces urine. And so the urine is the end of the journey, but it can tell us so much because it can tell us about of course, your hydration. It can tell us about uh, products that are in your blood. It could tell us about how well your kidneys are filtering um, the urine. There's just so much that we can learn from the end of the journey of your urine. So when we go from blood to urine, all that's happening in the kidneys. And step by step along the way, it's amazing. So, what we're going to discover today is that your urine is like a dashboard for your body. That's secret number one. Secret number two, natural substances and natural situations can change your urine color. But secret number three, there are some times when that urine color is a warning light. And so we want to be able to know what could be the danger points. And bonus secret number one, there are things we can do to help the whole situation. And bonus secret number two, we're not just guessing about what's going on. We're going to be able to measure, which is one of the 5 M's of total transformation. So we're going to cover all these secrets today. So buckle up. Now, here's our main article from healthline.com, Urine Colors Explained. And if you take a screenshot, that will take you right to the article, I believe. You know, you don't have to put in an email address or anything like that. It takes you right there, or you can just Google healthline.com urine, and a few of their articles will come up. But this article I love, and healthline.com loves it too, because this chart that I'm going to show you appears in multiple of their articles when they're talking about urine, dehydration, um, different things. So here's the chart. They have a urine color chart right in the article, and they have 10 different colors for the urine. And these are 5. I'm going to show you the next 5 in a sec. But also on the right, this is one of the reasons I love healthline.com, because they don't just give you the one article, they give you related articles. So if you look real close, the related stories, why is my urine brown? What do you need to know about discolored urine, et cetera, et cetera. So Healthline is a treasure trove. So here's the second part of that article, of that chart, the other 5 colors. And again, I'm showing you the QR code for the article again, because I really want you to grab this article. There's another thing in the article that I love, which they have a little less than a minute, right? Less than 30 seconds, uh, YouTube short about different colors of urine. And the thing I like about this article, this little short, is they compare your urine colors to common beverages like lemonade or iced tea or, light beer. So there's just, this whole article packs a lot of punch. You get a lot of bang for your buck when you spend the time to download it and check it out. So before we go on, I want to introduce myself. I'm Dr. Lisa Singletary, also known as the 100-pound weight loss specialist. And I developed the framework, the 5 M's to total transformation: mindset, macronutrients, micronutrients, motion, and measurement. So I'm wearing the wrong color shirt today. I should have on red for measurement. But we're going to talk about applying these 5 M's to our health journey, and that's our empowerment for transformation. A few statistics about me: I am a retired board-certified family physician, certified holistic health coach. I have a master's degree in public health. I am known for, and what I love to do, and I hope I do even today, is simplifying the science into clear, practical steps for not just for busy women 40 plus, but for anyone that wants to take the time to focus on their health journey. So with my medical expertise, my public health expertise, my anatomy and physiology expertise. I love, as well as my clinical experience, I love sharing this information with you in a way that you can grasp it and apply it to yourself. So I do have a personal transformation story. Uh, I was on a diet since I was 6, and it didn't work. And I think my maximum weight was around that time on the left. And that is also when I got introduced to the power of nutrition. And from one product, I moved from the picture on the left to the picture in the middle in 8 months. And then I'm still on the health journey today, but adding the rest of the 90 essential nutrients, cutting the carbs, sticking with the good food, bad food list. We'll talk about that later. But is all of uh, that is all a part of how I got from the picture on the left to the picture on the right. Now, in health and wellness, we don't talk about miracles, but I did. When I was at that maximum weight, I needed a miracle. And we don't talk about health miracles and health and wellness, but this is my disclaimer slide. So, uh, just so we're clear, although I am a retired board certified family physician, this is not a medical consultation. This is not a second opinion. This was not covered by insurance, right? This is hopefully educational and maybe a little entertaining. And I just want to give you some knowledge that will help you on your road to uh, transformation. All right. So we got 3 secrets. Secret number 1, your urine can tell you a lot about your body. So, and I know that you have seen in your own commode different colors over time, like at different times. And sometimes, um, like I said, sometimes it might be enough of a difference to make us really wonder, okay, is this a problem? But remember, a lot of normal things can cause urine color. So things that you eat, supplements that you take, uh, like like I said, a lot of different situations can change your urine color. So it's important to know what's going on and is it something that I need to get checked out. Now, hydration is just the beginning. It's just one of the things that your urine can tell us. So the color of your urine is called urochrome. And depending on how dehydrated or how hydrated you are, that's going to give a different appearance to your color, to the color of your urine. And that tells us a lot, okay? But secret number 2, even though we have natural substances that can change, secret number 2 is looking a little deeper at the natural substances that can change our urine color. So you might see some different colors, but you don't have to panic. Some factors, such as the color of and they're superfruits and super vegetables, with these deep pigments. The pigments actually are part of the antioxidant protection of the fruits and vegetables. So we borrow their antioxidants and helps our bodies with oxidative stress, but their antioxidants are often deeply pigmented, and that pigment can show in our urine. Also, some supplements that we take or some medications that we take can cause different changes in our urine. In fact, when someone is taking the supplements that I take for the first time, uh, I tell them, I'm pretty sure I do tell people that not to be alarmed because your urine color is going to change. And if I forget to tell them and they're like, "Oh, my urine is so orange now," or so this, I'm like, that lets me know. Or if I don't hear from them, I know, okay, you did take them. So it's a clue. And as you saw on the chart from in the Healthline article, there are different color spectra. Spectra. So the red, pink, you're gonna think things that are in your diet, such as beets, rhubarb, um, deeply purple things. Uh, the orange uh, area, you're going to think, okay, dehydration or maybe B1 vitamins or different supplements. The blue green, that's going to be more of in my mind, I call it esoteric, right? When people take methylene blue, that's in the news these days. So different colors can indicate different things. But if we look at the far right, when red, pink is a problem, then, or the red, that can be a signal that there's blood in the urine. That's a problem, right? Or the orange, the yellow orange, can be an indication of liver or bile duct issues. Um, and usually when that happens, you're going to see it in other areas too, like the sclera. So the whites of the eyes can turn yellow, right? So they're different, again, different colors that cause a little bit of alarm. So we need to be able to have a slight clue as to whether we need to panic or not, right? So secret number three, that's okay. These are the things in our dashboard that you don't want to see, right? And if you see them, we need to look further. So if your urine looks like Coca-Cola or iced tea or rusty water, that's a red flag. And you want to seek medical evaluation. Now we have a list on the right of some of the things that it could be, but you generally we know that in order for blood products to get into the urine, they have to get through that filter at the glomerulus. So it could be it could be there could be multiple things going on, but we also have to remember that that's where it started. So the glomerulus has a specific type of capillary, is a specific type of capillary. It's called a fenestrated capillary, and that means it's porous. It's like a sieve. And so when the capillaries is when the capillaries are intact, and remember the capillaries are only one cell thick, the pores in the capillary cells can keep the blood cells and proteins and larger particles inside the blood and just let the filtrate come through. But if there's damage to the capillary, to the lining of the capillary, then it's going to let things through that are supposed to stay inside the blood, but now they're going to get through and come out into your urine. And that's when we can see some of the different things like foam or the colors we just talked about, the tea colored urine and other problems. So we talked about what can cause the capillaries to break down. And we talked about glycosylated hemoglobin. We talked about pressure, all the things that can happen. So that was all in webinar 68. That damages the lining, that damages the road that the blood is trying to flow through. But we want to have a smooth road. We want to have a repaired um, lining in our capillaries. And this is something that we can do. There's some natural substances that can help the oxidative stress and inflammation that happens in the capillaries. And two of my favorites are Fucoidan and medicinal mushrooms. And I love that I found this article. I hope I put maybe I'll put the article a little later. But these are things that we can do to help maintain the flow. So functional hydration. A lot of uh, my favorite supplements come in liquid form or powder form, and that actually helps me to drink more water. Let me see. I gotta move that. The Again, protecting the kidneys, the kidney protection protocol can include things that help to decrease oxidative stress and um, inflammation. Let's see here. I'm sorry, I moved this thing. It was in the way. Let's see. Here we go. Okay, so one of the things that we can do, and I love this, before we have to decide, um, or to help us decide how important the changes are that we see in our urine, there are things called, and these are the things that we can measure. These are things that are used in your clinic. They're not this digital yet, as far as I know, but they're called urine test strips or um, your multi sticks, right? So there are sticks that you can buy anywhere, and whether it's in a pharmacy or just a grocery store or drugstore or super, box store, in their aisle, in the health aisle, they will have different types of ketose, of urine sticks. Now, some of the sticks are, like I just made a little slip there, some of the sticks are for ketones, and they might just have one or two little pads on the strips. Some of the strips are for glucose. Some of the strips are for, a variety of issues, but there are strips that have multiple little pads, and each little pad is like a little chemical test factory. And you urinate on the pad, wait a few seconds, and you can compare the color with the legend on the bottle. So that gives us a huge clue as to what's going on in our bodies for multiple things that may be coming through our urine that aren't supposed to come through, or just to give us a state of the body. What's the pH? What is the glucose level, etc. And sometimes, let's say you saw some redness in your urine, but you ate a big thing of pickled beets the night before, and you have an idea. Okay, number one, I have a reason that I saw this change, but also over the next few hours, or yeah, well, just say hours, uh, it disappears and your urine goes back to the normal color. That's what we would call a blip. And what you would do in that case is make sure you stay hydrated and monitor yourself just to make sure that was it. And that's what we would call an acute change or acute pattern. But over time, we might see a chronic pattern or even a trend that's upward. And that's when we really want to pay attention, but also we want to get some further testing and some further advice. So you are in the driver's seat. We want to keep you flowing, filtering, functioning. So have what is one action step you're going to think about this week? Well, let's see what else we could consider. So, oh, here we go. So some of the action steps that we want to use to clear the road, you want to keep your pressure down. Now, for extreme pressure, we still sometimes have to rely on medication, but you know what? A lot of times, if we got the sugar and the diet under control, we're going to see benefits in the pressure. Speaking of controlling our sugar, we saw what happens when our red blood cells get sugar spikes on them, and they cause the damage in the road. But guess what? We can manage what goes into our mouths, right? No one forces carbs and sugars into our mouths. We have control over that. Good food, bad food list that will help what's causing inflammation and oxidative stress. So we have a lot of control. But we can also, this is the article I thought I said, we can also add some things to our supplements that help to decrease oxidative stress and inflammation and give our bodies a chance to get our capillaries cleared and normal. So this is a big, these are a lot of big words, right? Glycosaminoglycans and fucoidan have a protective effect on experimental glomerulonephritis. The easy way to say that is mushrooms and seaweed can help your kidneys, but not just the kidneys in general. The balls, the capillaries in the cortex, where that are highly under pressure, where all of this whole journey of urine begins. So, step number one, we have to avoid the bad foods. I can't say it enough. Because every time we take bad foods and we cause inflammation or oxidative stress in our bodies, the pressure is highest in those delicate kidney capillaries, the glomerulus. Step number two, we need the 90 essential nutrients. A lot of people have an idea now that vitamins are good and vitamins are necessary for the body. But what people don't realize is the minerals are needed to help the vitamins work. So there are all kinds of cofactors. And we're learning about cofactors. Like people know, or I'll say in the general knowledge, people now associate D3 with K2. They're cofactors. So we need all 90 essential nutrients every day for life. Step number three, this might be my favorite step, is antioxidants, adaptogens, anti-inflammatories. This is where the fucoidan and the mushrooms live, the medicinal mushrooms, in enhancing the 90 essential nutrients. Step four, so important. You are not what you eat, you are what you absorb. So if your gut lining isn't healthy, you're not going to be able to absorb the nutrients that are in your food or in the supplements. Step five, wellness wonderland. This is all of the other things that are available to us to help us on our health journey. Brain support, joint support, red light therapy, cryotherapy, not medicinal, art therapy, massage, energy medicine. All these things I categorize as wellness wonderland, but they all rest on the foundation of the previous 4 steps. And what are the 90 essential nutrients? 60 essential minerals, 16 essential vitamins, 12 essential amino acids, and 2 to 3 essential fatty acids. And the word essential means your body needs them. But medically, the word essential means your body can't make them. You know, there's some things that your body can rob Peter to make Paul. Your body's amazing. So it can take some proteins and make sugars and things like that. But these essentials, your body can't do that. You have to take them in as food, good luck with that, or as a supplement. Oh, I've got a gift for you today. So we talked the foundation understanding of our urine is, the hydration state. And I found this article years ago about the pH and osmolality of sports drinks. And it just happened to be this was a study done in Switzerland. But from that study, I made this this infographic. And it shows, if you look above the car, there's a number 290. And the osmolality, or the concentration of the beverages that you drink, if that concentration is over 290, then you think that drink that you're taking in is going to hydrate you or quench your thirst, but it's really pulling water out of your cells and dehydrating you. So we want to keep an eye out for these danger zone beverages. Number one is red wine. So look at that. That's almost 10 times the milliosmoles of the blood. So drinking red wine, although it does have maybe some grapeseed extract or, some benefits, it can be a very dangerous situation as far as dehydrating you on a cellular level. So, I've got a quick fix for that. Hold on. But beer, again, multiples more concentrated than the blood. Now, here's one that people really aren't aware of a lot of times, and that is regular juices, apple juice, orange juice, right? Pineapple, all of these juices, they're very concentrated. Soft drinks, which generally we shouldn't be drinking, but especially not with meals, okay? No carbonated beverages with meals. But these soft drinks, you think you're going to get a nice, refreshing Coca-Cola or, just any any soda. And what you're doing is you're dehydrating yourself more. Sports drinks, now that was a surprise, right? That they could be so concentrated. Now, keep in mind, the Gatorade that we have today is not the Gatorade that was initially studied and initially created for I think it was the Florida Gators football team. But because of commercial tastes or commercial practices over the years, the formulas change, and so I'm not going to tell you have to read the bottles, because we have a quick fix for you. But number one, you can watch your urine, right? After you take these beverages, and if you see your urine darkening, that's your internal hydration gauge, then you know in your body that these things are having an effect. But what can you do? So dilution is the quickest trick. And if you look all the way in the bottom, this is a recommendation that I have. Anytime you drink something such as apple juice, or if you do drink a Gatorade or something like, or we've got much better options for your sports recovery, for your hydration. But just if you're in the situation where you're drinking a soda, take the same container, or the apple juice, take the same glass that you drank the juice from and fill it with water. And then, so you're chasing that beverage with water, and that's going to help to balance out the osmolality. Now, if it's red wine, then you're going to have to take 7 glasses of water for each 1 glass of wine to make it suitable for the blood. But most of the time, it's going to be some kind of juice maybe that you drink. Just the same, right after you drink the juice, take the same cup or the same container, fill it with water, and chase it down. And that will make the hydration or the osmolality practically perfect in every way, as Mary Poppins would say. So I have this list for you. I have this infographic for you. Just scan the QR code, take a screenshot, email it to yourself, scan it later. But it's a free download for you, and I just want you to have this information in your hand and a little reminder to dilute, take 1 for 2, right? Chase whatever you're drinking with water if it's going to be one of these high osmolar beverages. All right, so just take a screenshot, get the download, and vroom, vroom, we're on our way. So thank you for joining me today for learning the secrets of liquid intelligence. And what's the next step? Well, we have a whole community. It's a new community, but it is amazing. It's vibrant. It's packed with health coaches. It's packed with free education. You can get a free ebook. You can take a free health course, recipes, resources, support. It's an amazing community, and it's free, right? Just scan the QR code. You can join the community with that link, and we welcome you to just learn more about the Wallach approved health information and getting to elevating your health to the optimal place. All right, so webinar 69 is in the can. And thank you for those of you who are here live. Stay tuned because we'll have our little after show chat. But if you are here on the recording, thank you for joining us. Maybe you want to join us live. We do have some fun. And all you have to do is scan the QR code, and that will allow you to register for our live weekly Zooms. But the fun's not over, because every Saturday evening at 9 p.m., I put the recording from the morning live onto YouTube. And the first time the recording hits is called a premiere. And I'll be in the chat live for the premiere. So I invite you to join me at 9 p.m. Eastern tonight, and we'll have some fun in the chat. Just go to my channel and you'll see it as the most recent video, or if we are in touch, I'll send you the direct link. All right, so we're exposing the secrets, we're having some fun, and the red Corvette is getting ready to ride. I thank you all for joining me today, and I will see you tonight at 9. Vroom, vroom. Bye-bye. Oh, mwah.